Hi, I'm Emma. I'm course leader for health and social care. I'm just going to go through a little bit about the course and the qualification and what we offer you during your time at QE.
And I'm Sarah, and I teach on this course at QE.
We offer health and social care as a single and a double award. All that simply means is if you do single, you do a single A level. So that's one of your option blocks. If you do double, it's two of your A level option blocks. So that would only leave you with one other subject to take at A level. It's a really, really nice qualification because we can offer you a nice broad range of units. You'll be able to do units on nutrition. There's supporting people with mental health conditions. There are exams on this unit, so if you do the single A level, you will have 3 exams over the course of your 2 years. If you do the double A level, then it's 5 exams and 7 coursework units. There are some units that are not set by us, that are set by the exam board, and they're non-negotiable. So there's building positive relationships coursework unit. There's equality and diversity, which is an exam, and health and safety, which are exams. Also on single A level, there's an anatomy and physiology exam. But alongside that, there's supporting people with mental health conditions and nutrition, because we thought it was important that you get a realistic and reflective experience in terms of what you might face in each of the different settings. So there's nutrition, obviously, for those of you heading off maybe to work in healthcare or with younger people, supporting people with mental health conditions, because that's important, because 1 in 4 of us at some point in our lifetime are likely to face some of those challenges. And we also are quite chuffed that there's an anatomy exam, well, sort of chuffed, because I don't really want to send you off to be a nurse if you don't know what body systems do. And then also in the double awards, there's some safeguarding units, so you know how to protect people who are vulnerable and what the procedures and things are. And there's also a unit about physiological disorders and some psychology in that instance. The reason we suggest you might want to do double over single is because if you definitely want to work in health and social care, it might be more appropriate. That way, if you've got more of a leaning to learning through coursework and applying your knowledge, double might be better than single. If you want to work in primary education, maybe, then maybe single A level is more appropriate alongside a national curriculum subject as well at A level, or a psychology in that instance. The course is designed to be vocational. So what that simply means is that we try and use examples from different settings, and we try and make sure they're tailored towards your career goals and career aspirations and things like that. Obviously, in current circumstances, it's going to be a bit challenging to get some work experience in a hospital ward, but we do try and have speakers and things like that. So we're going to have to look to do that remotely, obviously, at this point in time. There is a section of this evening for you to send us your questions. So if you'd like to be ongoing and do that, then we'll do our best to answer them as you see fit. Okay. What else have I missed?
No, I would think that you've probably covered the main points there. So it is quite important, I think, as Emma was just saying there, to sort of understand the difference between the single and the double. If you're doing the double, as Emma said, it's 2 of your blocks. So that's like 10 hours a week in class of health and social care. Plus, on top of that, the sort of work that you'd be doing outside of class as well. And if you do the double, you'd have one other option. And I think it's also important to know that the option that you take would have to be an A-level option. So you couldn't mix double health and social care with, say, for example, sport and travel, the BTEC in sport and travel, or the criminology course. You'd have to match it up with an A-level course. So we have a lot of people doing it alongside sociology, psychology, Psychology is a very popular one
Yeah.
for people to do alongside it, actually, with the double award. So yeah, so just be aware of that as well. Yeah. And the importance of having to really be organized because you do so many units, and you're sort of doing more than one unit at the same time. So it's important to like make sure that you're sort of able to be organized and things as well. So that's what I would say as well. I'll tell you a little bit about the unit that I'm teaching, because I think I say that's my favourite unit. I think I've got the good thing here. I'm actually teaching the supporting people with mental health conditions. So again, as Emma was saying, it's obviously designed to be vocational. So we're sort of like thinking about mental health conditions, not only in a sort of theoretical thing about, well, what is depression, for example, and what are the causes of depression. We do look at that, obviously, but then you actually apply those to case studies. So you will come up with case studies, and you'll be asked to sort of think about, right, well, how might this particular person who's presenting with this particular set of symptoms, how might they be treated? Because it might be very different for people who are, you know, presenting with different issues of mental health conditions. Oh, Kate's asked a question there.
Right, so we've got a question. To go into nursing, would single or double be more appropriate? I guess either will be fine. It depends what other things you're interested in. Alongside a psychology would be quite useful, because obviously within psychology, as it stands at the moment, there's topics about addictive behavior and things like that. If you definitely want to be a nurse, then maybe the safeguarding, the infection control, and the other types of units that are on double would be more appropriate.
Yeah.
But you might find once you do more webinars and a bit more research about QE and what life's like at QE, there are loads of different topics that you're interested in, and subjects, so that you might want to just do single. Either would be fine in terms of getting into nursing.
The other thing that I would say about nursing is such a competitive course to get into at university. They look at other things besides the subjects that you're doing. So they would be looking at the sort of the extracurricular activities that you might be doing. And I think that QE does offer like a really excellent set of extracurricular opportunities that really enhance the nursing application. So we've had loads of students. One of the health students actually is the president of the Interact Club, which is looking at, they've done loads and loads. It amazes me what they do, but they like work with sort of hospitals, and they've sent cards out to people who've been socially isolated. So I agree, Emma, it doesn't really matter if you do single or double. Think about what your interests are, because they're going to also look at the grades that you get as well.
So we've got another question about UCAS points to be able to get into social work. So this qualification is an A-level equivalent. So it's a Cambridge technical. So you will get grades, distinction star, distinction, and so on. If you get a distinction star, that is 56 UCAS points. A distinction will be 48, and then it works down. So you will get the same level of UCAS points as you would if you did an A-level. And health and social care would be perfect for helping you get onto a social work degree. You might want to look into sociology as well. You look at, obviously, the different factors that impact on people's lives in that way.
Well, things like law, for example, might be good for social work as well, potentially as well, But again, like with nursing, social work is, again, a very competitive course, and being able to show that you've got the skills, not just the sort of the academic qualification, but the sort of the personal skills that you need to be a social worker, because that is not an easy job. So that's going to be really important as well.
Somebody's asked, do you only take one A-level alongside double? So yeah, that's what it will be. That's what it is currently this year. So double is 2 A-levels, so it's 2 of your option blocks. And because it's a vocational A-level equivalent course, you will have to take one other A-level. So you couldn't, as Sarah said earlier, you couldn't take sport and leisure or travel
or applied science
or media technical or applied science. It would have to be So it would have to be an A level in sociology, an A level in psychology or English or whatever else it might be. Our next question is about radiology. Health and social care is perfect for radiology. In fact, one of our students left last year and that's what they've headed off to do at Teesside. So yeah, that's one of the main reasons why we teach some of the units that we teach, so that you can head off into healthcare or you can head off into early years to work in primary as well.
So what would we recommend to pair with this subject if you wanted to be a nurse? And similar question there from Lucy as well about what other courses do you feel complement it? Well, as you were saying, I think in terms of like wanting to be a nurse, it goes really well with biology, psychology. If you're doing the single award health and social care, you could do it alongside, say, applied science if you wanted to go into nursing. And in terms of what other courses, as Lucy asks there, what other courses do you feel complement health and social care? I would honestly say pretty much any of them. If you're thinking about you maybe want to go into, say, something like teaching, like primary school teaching, then you might go down the sort of route of maybe doing it alongside English or geography or history, you know, one of the national curriculum subjects. If you're interested in sort of more about people than the psychology, the sociology, it would really go with pretty much most things, because one of the nice things I think about health and social care is the skills that you get from it are just so transferable to all subjects. So you'll be like, you know, learning and you know, like writing skills and time management skills and all of these types of things. So it's really useful.
Sometimes it's quite useful. You yourself can go on the UCAS website and just type in ucas.com and just do a course search. And within that, you can obviously search adult nursing, child nursing or whatever. And that should give you, in certain universities, a list of entry requirements and things like that. So sometimes it's quite useful to look at what you want to do and work backwards to where what A levels you need in order to then get there. Oh, sorry, I'm lost with the questions.
Hazel was next.
Okay. What topics are in the single course and how much is science and nutrition? So single, you do 3 units in first year, 3 units in second year. Your first year consists of mandatory units that are set by the exam board. We have no control over these, and I'm going to slightly apologise for them. But there's building positive relationships, which is about communication and person-centred approach to care. Then there's equality and diversity. So you look at how and why people are different, legislation in place, if people are discriminated against and things like that. And then there's a health and safety unit, which is as exciting as it sounds, but within that you will do looking at risks, risk assessment, legislation.
I don't mind a bit of health and safety. I like a bit of health and safety.
Anyway, let's move on. And you'll look at responses. And then in the second year, that's when you'll do anatomy and physiology. Now, the anatomy and physiology is about body systems and disorders of the body system. So it's not going into lots of detail about bits of biology that was really challenging at GCSE. It is about the cardiovascular system, the respiratory system, the different parts of that, how they work together. Alongside that, there's nutrition, which looks at different nutrients, factors that affect nutrition. And then within, you'll write a diet plan to address different nutritional needs. So that's kind of your science of nutrition. And then the final single award unit is supporting people with mental health conditions.
Which is pretty good, because that's the one I'm doing. No, it's really interesting. You get to choose a mental health condition to look alongside depression. So you can look at, you know, phobias or schizophrenia. So it's quite interesting from that point of view. Not much science in it. I mean, you have to have a bit of like the biological causes of how these disorders occur, but it's not, again, as Emma's saying, like going into huge amounts of scientific detail. And what I would also say as well for the anatomy and physiology unit is that we do have one of the science specialists, science teachers actually delivering that one as well. So
right, let's do another question before we're here for all night. Can you do double health and social care alongside criminology? No. Sadly, unfortunately. You can do single health alongside criminology, but then you would still need to take an A level. Next question, can you do double health and social care and become a primary school teacher? Yes, pretty much. I would suggest you maybe take an English alongside that or a national curriculum subject. But yes, you can apply to do primary education and do that. If you didn't, there are also other qualifications, so you can do early year studies and things like that, and childhood studies, if you decided it wasn't quite fully primary ed you wanted to go into. Do we learn skills that will help me become an occupational therapist? Yes. So the mandatory units are set up because the qualification is part being written in conjunction with people like the Care Quality Commission, who were sort of Ofsted for health and social care. So they've helped write that. So you will look at how you talk to people, barriers to communication. You will look at how you can empathize with people, how you can support people making decisions, and that sort of information. And obviously the anatomy unit is linked into that, because part of that, one of the body systems you will look at will be the musculoskeletal system. So that'll be quite useful in terms of heading off to do occupational therapy.
And again, certainly in the mental health unit and the physiological disorders one, you do sort of think about the ways that you can actually support people with, you know, mental health conditions, and you can look at the roles of things like occupational therapists within that and the role that they play. So it's good to see the sort of range of things that an occupational therapist would actually do.
We've got a question from Leah about extracurricular activities recommend to pair with health and social care. We're really fortunate at QE to have an Interact club and a student association that are very active in terms of the local community. So they've done an awful lot of things during lockdown. You might have seen on some of our social media about sending cards to people who've been isolated. Earlier on in the year, they prepared packages and they delivered them around Christmas time to things like the Women's Refuge and things like that. Anything to do with that, or that, any extracurricular activity where you're talking to different people, where you're showing initiative, you're showing you're caring and compassionate, and all of those sort of important soft skills that are vital in health and social care would be fantastic. So if you could get involved in the student association or Interact, that'd be brilliant. But even if you're getting involved in sport, in whatever sort of capacity we're able to offer that, that would be brilliant, because again, that's teamwork, that's communication, and that's showing commitment and all of those sort of important things. Do you have to do biology to be an occupational therapist?
It depends on the university. So
I think it's recommended, as far as I'm aware. If you are going to struggle to access biology, I suggest you look at applied science. And quite often, sometimes some universities will allow you to do psychology as your science. So I think biology would be preferred, but if biology is challenging for you, then there are other qualifications and other ways around it. Is it necessary to do a national curriculum subject if you want to become a teacher? I think it's preferred.
Primary school in
particularly for primary. But if you have other strings to your bow and you can offer other things, then you could go around it that way. I mean, some teachers don't necessarily have at A level the qualification that they now teach, but that sometimes that overlaps with what courses are able to be offered. There are also other routes into teaching, so you don't necessarily have to go through a degree in order to get into teaching, do a teaching degree, to get into teaching. You could look at childhood studies or early years and foundation studies and things like that, and then do a PGCE to be a primary school teacher, which is a 1-year teaching qualification. You can also do sort of graduate apprentice type schemes as well through schools. I think a national curriculum subject again is preferred, but not vital. There are other ways and other routes into teaching.
But I'd strongly recommend doing one, because it'll keep your options open for definite, because some universities might be quite, well, we want it. Yeah.
So that, I guess that's where your research comes in, and looking on UCAS and bits and pieces and seeing.
I know it sounds very strange. You're only just like looking at sixth form colleges and your options for A levels, and sort of after your GCSEs, and we're sort of going, well, go and look at universities and look at what the universities are saying. But I guess it is important because, you know, it is important to make sure that you get the right choices like now when you start at college. So when you go on to university, you know, you're able, you're in the position to be able to go on to do what it is that you want to do in the future. We'd hate for anybody to sort of like not be able to progress to what they want to do just because they kind of maybe hadn't sort of quite picked the right things to do at college. So what's your favourite unit then this year then, Emma?
Well, I think I'm a bit of a sucker for anatomy and physiology, and I'm quite looking forward to some of the units next year. Yeah. So I think the psychology one should be interesting, looking at different types of therapies, and how, again, how you can support people. That would be quite useful. And also, I quite like physiological disorders.
Yeah. Well, yes, you've got a.
But it's quite useful because you look at tests and how things are diagnosed, and how different practitioners work together. So it is relevant for anybody wanting to head off into health and social care, or healthcare in particular.
It's a question from Jess.
Do I have to have done health and social care at GCSE to take it for A-level? No, pretty much is the answer. We offer a Cambridge technical, so again, that might be different from what you've done at GCSE. So it doesn't matter. We'll get you up to speed with all the terminology and the different bits and pieces.
I would say most of people haven't, certainly that I seem to have, most people haven't done it at GCSE. Which is quite, I suppose, nice, because one of the nice things about coming to college is that you get to do different new subjects and things, you know, something that you maybe haven't done before. Can I just quickly sort of say about the exam units as well? Yeah, I just want to say, one of the really nice things that Emma has sort of put in this year for the exam units, because you do an exam in January in your first year on equality, diversity and rights. And one of the nice things that you've built into the timetable, which is working really well, is you actually have a lesson a week that is retrieval practice. And that lesson a week is all about consolidating and refreshing and revisiting the content of the course, looking at it in a different way, applying it, and developing those skills that you were saying about it being an applying in a vocational course. So I think that is working really well this year.
I hope so.
Yeah, well, we'll see. Yeah, but it is good. I think it's really working well. So, Kate's asked a question here about coursework. So.
Okay, so what percentage of the course is coursework? If you do single, it is 50-50. So it's 50% exams. So you do 3 exams, and then you've got 3 coursework units, 2 exams in your first year, and 1 exam in your second year. So obviously then your coursework swaps around. So it's 1 coursework in first year, 2 exams in second year. If you do double, that is 7 coursework units overall and 5 exams. So it's 3 exams in first year, 2 exams in second year. You're allowed to do the exams 3 times, which is why we've got, as it stands, exams in January. So they'll do 1 exam in January and 1 in the summer. And you can then resit in the summer that way if you need to. So that's why we're trying to spread it out and teach it as separate units. What grades do we need to get in health and social care? We don't, to be perfectly honest, because you don't have to take health and social care at GCSE to do health and social care with us. We don't necessarily ask, in terms of entry requirements, a specific grade for health and social care. We strongly recommend that you have 4s in your English and your science or biology, depending on what you're going to do, whether it's dual or double science. I never quite remember. So we suggest 4s in English and science, but the only reason we recommend those is just because of the way you'll be assessed. So obviously you're going to have to write your coursework, you're going to have to write some longer answer exam questions, and there is some science content on the single course as well.
So Hazel, what does the single coursework involve?
Okay, so your single coursework units are building positive relationships. So that's about the different types of relationships in health and social care. It's about how you can build them. So how you can make sure that people trust you, how they're open and honest, how any interactions you have with them are meaningful. So you look at barriers, how to overcome those barriers in that instance. So that's your only first year coursework unit. In second year, your coursework units are nutrition, which is about different types of nutrients, functions of those nutrients, and then you'll look at analysing diet plans and writing better diet plans. And then you'll also do supporting people with mental health conditions. So you look at the different types, how those types might affect people, and then you can look at support and services that are in place for people who have a specific mental health condition. Okay. Oh, next question. What coursework do you do in the double? Well, you do all that single stuff that I've just said. And then there's an infection control coursework unit,
it's very topical.
It's
very topical
currently, which is set by the exam board. That's not set by us. So you'll look at obviously different types of infection and then measures in place to minimize the spread of infection. So a bit of sanitizing and hand washing and things links in there. And then there's an impact of physiological, long-term physiological conditions. So you'll look at different types of conditions, treatments available, how they're diagnosed, people involved in supporting people in that instance. And then there's a psychology unit as well. So you'll look at different theories of psychology and then how those theories can be used to treat people. So if you look at maybe the biological approach and theories within the biological approach, you then might look at medication and how medication can be used to help somebody.
Oh, university's good to go to after college to become a teacher. Durham University has an excellent, if it's primary school teaching, Durham University is an excellent primary school.
We have a lot of students that have headed off to York St John as well.
York St John, yeah.
But
But to be honest, what I would say, Jess, about what universities, about what you want to go into is look at the, think about where it is that you want to go. Think about, and like, universities, they're all, they're pretty good. The ones that are geared up for teaching, they know that that's what they do and things. So I would say, think about where you want to go as well, and sort of maybe what sort of like university experience you'd want to have.
Sometimes resources like the Complete University Guide are quite good. So if you look at things like that, you'll get the top sort of institutions for certain qualifications. So there's quite a few within Yorkshire and the northeast that are in the top 10 in the country and things for things like nursing as well.
Oh, Teesside, yeah.
Right. If I don't pass science, will I still be able to take health and social care? Probably. If I'm being it would obviously depend on your other results. Having to see where you are in terms of it, sort of passing your other GCSEs to do a level 3 course at QE. We ask that you get you get 5 4s. Say that the right way around. And that should get you on a level 3 course. And then what we do is on results day, we'll look at where your grades are, and where you've perhaps not quite made it, but then you might have really overachieved in another similar qualification, and whether a different skill. So it's not, it doesn't mean no if you don't pass science. It's advisable for you to have it because it will help you with the content that we cover. What uni could I go to be an occupational therapist? Well, again, probably I would go to things like the Complete University Guide or UCAS, and do a course search and look that way. You might want to stay in the northeast.
Teesside's an outstanding school of health and social care courses, which would include things like occupational therapy, but you might, as you say, want to go further afield.
And I think probably in current circumstances, it might it might maybe, I guess, depends what happens where we are nationally in terms of where you want to go. But quite Northumbria are very good. York are very good in that instance.
Final question.
Oh, how big are each of the classes? Somewhere roughly between 20 and 24. It varies slightly. Our classrooms are set up with 24 desks. So that's kind of our maximum class size in that instance.
Brilliant.
Yeah. Oh, is that our last question?
That was the last question. Yeah.
Marvellous.
So thank you very much.
I hope it's been useful. If
some really good questions.
If you still have another question that we haven't answered, or you didn't get a chance to answer, then feel free to email QE and the inquiries button that's on the QE website homepage, and they'll pass any queries and things on to us.
Yeah. Good luck in all your GCSEs, and hopefully at some point we will get to see you in some way, shape or form. So.